It's 4:38. Welcome back. And in your health headlines this morning, May is Mental Health Awareness Month. Reports show anxiety and depression are two of the most common mental health conditions for adults here in the U.S. But not everyone responds to traditional treatment, which is why researchers are now exploring the use of psychedelics.
Our existing treatments, there's a little variability depending on the particular condition, but generally about a third of patients with a particular condition will not respond to any psychiatric treatment. So when you think about that at scale, that's millions of people who have depression, anxiety, bipolar disorder that's not responding to treatment.
Dr. Brian Barnett is a psychiatrist with Cleveland Clinic, and he's been studying the use of psilocybin and LSD to treat anxiety and depression, and the results have been promising. So how exactly do they work? Dr. Barnett says they are not entirely sure, but it's believed they turn on certain receptors in the brain and also help with neuroplasticity, making it easier for a person to learn new behaviors. Dr. Barnett says these kinds of psychedelics would never just be handed to a patient as part of their treatment. Instead, they would be administered in a supervised medical setting.
They are drugs with strong psychoactive effects, and so that's something we take very seriously. So safety is very important. But over the decades, we have developed ways to reduce side effects and ensure that patients are able to take these safely in a supervised medical setting. There will never be a point where the FDA is going to approve sending psychedelics home with people.
Dr. Barnett says clinical trials are still ongoing. However, it's possible the use of certain psychedelics could be approved by the FDA in the next couple of years.